My son recently suffered a medical emergency, and we had his doctor's appointment follow-up the other day. And interestingly enough, I have not been in care at my site, but I'll give you an example on where AI has come from. His provider said, "Hey, I'm about to meet with you. I don't want to type notes in the chart. Are you okay if I use my AI transcription tool so that I can be focused in conversation with you? And it's just going to capture what we say. I'm going to go through it." Well, can you imagine how much more time we got to actually be engaged with our provider in that 60-minute follow-up appointment versus had she been needing to type and ask us to repeat and go back and making sure she confirmed what we said. So I think AI is the way of the future. It's about innovating in a space where it allows the provider to have more direct care, or the care team themselves to have more direct interaction with the patients that they're serving.
Welcome back to an episode here on the Heart and Hustle podcast. This time we have Miss October. How you doing today, ma'am?
Hey, Ephraim, how are you?
You know, it's cold, but I hate to tell people that, especially that I'm from Florida. There's like cold wear. Listen, it's 40 degrees here. How cold is it for you, October?
Texas is beating y'all today, and we're gonna get up to 60. So we're
Oh, I can't
winning.
wait. I can't wait. October, what's the organization you represent? Let people know where we're coming from.
Absolutely. I'm the Vice President of People Partnerships and Engagement with Central Health, which is the Travis County Hospital District. So we are privileged and honored to serve our community of uninsured and underinsured residents with quality, dignified health care. So that's what I do. I lead a team of
Okay.
folks that empower and enable leaders and our team members to do that.
And I love that people are in this space because I couldn't do it, right? Like when it comes to just like, maybe I could have done the back end. I hate when it comes to like blood and all that. Maybe that's why you're in the back end. Is that correct? Is that why you're in the back seat and not actually, boots on
No,
ground?
that's not correct. Actually,
No?
I
Okay.
come from the front seat. So I
Okay.
did direct patient care for a very long time, bedside, clinics, multiple spaces. But I came to the background because when you're at the bedside, though, it's very impactful and you're with the people, you're only impacting those individuals there that you're serving, their families, them as patients. But when you step back here, it enlarges your scope of who you can touch. So now I get to touch a system,
Yeah.
enable the folks who are bedside.
I was about to say, and really, I think it is cool that you've been, how many years did you spend at the bedside?
More than 20. I don't want to age myself.
So you're bringing in knowledge, right? And I love from a leadership perspective because a lot of times people sit in those seats and may not know what goes on right at bedside, but no, you have the insight of 20 years of what it looked like, and now you know what needs to be fixed. What are some of those things? Some of those things that when you were at bedside, you're like, man, I wish somebody could really take care of this problem. And now, October, you're taking care of that problem. What are those some of those issues?
I would say I didn't want to age myself, but I would say healthcare has come a very long way. So we have electronic medical records. I can tell you when I was bedside in hospitals and clinics, we still have paper charts with
Oh, Lord Jesus.
with triplicates that you needed to send physician orders off. So we have come a long way. Some of those barriers to just consistency, ensuring accuracy and care have really been implemented. I think it's still the age old adage of not enough time to do all the things you want to do. And I don't know that we have solved for that
Yeah.
yet. Just making sure we're able to again deliver the care that our patients and our families need.
You mentioned paper documentation. You mentioned not aging yourself, but listen, 20 years ago, right? We didn't have computers, maybe. Well, no,
We had
yeah, we started computers. We started computers. We didn't have AI. We didn't have social media. All these technology is very evolving, and I would actually kind of bring it back to that AI and the automation. That plays a huge factor into the healthcare space. I think a space that has been really trailing behind for some apparent reason on innovation. Where do you guys see yourself now with AI and technology and ambient listening and all these different things coming to the table?
I think that goes to help close that gap of time, right? So, my son recently suffered a medical emergency, and we had his doctor's appointment follow up the other day. And interestingly enough, I have not been in care at my site, but I'll give you an example on where AI has come from. His provider said, "Hey, I'm about to meet with you. I don't want to type notes in the chart. Are you okay if I use my AI transcription tool so that I can be focused in conversation with you? And it's just going to capture what we say. I'm going to go through it." Well, can you imagine how much more time we got to actually be engaged with our provider in that 60-minute follow up appointment
Yeah.
versus had she been needing to type and ask us to repeat and go back and making sure she confirmed what we said. So I think AI is the way of the future. It's about innovating in a space where it allows the provider to have more direct care or the care team themselves to have more direct interaction
Hmm.
with the patients that they're serving.
And I agree. The experience is everything. Like that, you can have an experience where you're not being cut off. Like, wait, hold that thought. Let me write this down. Or what did you just say? I was totally writing this down. And I think we've lost that over the years, right? That we used to have family doctors, and now we don't. The experience is not what it used to be, and I think that also kind of rubs people the wrong way. And one, they won't go back to a hospital. Two, they just won't go back at all, right? And I always bring this story, but I think it's really funny that we got to be very mindful of our experiences with people. So I went to this doctor. My wife says, "Hey, you should go to this doctor," and I was like, "Cool." You know, as men, we don't go often, but I decided to go, and I went, and I'm a talker, so I'm talking to the lady like, "Oh, hey, how you doing? My wife brought me here," and she's like, just obviously typing away, not really looking at me. I said, "My wife was just here. You remember my wife, right?" And she's just lying. "Yeah, yeah, yeah. This and this and this," and she's going on and on. So then you know, everything finishes. I go to my wife and I says, the lady that you said like, what does she look like? And then we start explaining. I was like, well, the lady said she knew you, but she didn't look like this. The lady was just lying, right? It was just kind of in and out. It's the same question she asked everybody. I gotta hurry up, gotta hurry up. So I think yes, AI is in a place, and I think we have even really got to tap where we could be in, like tap in. And I'll give you some more information after this call, because I think that AI, man, it's such a game changer, to be quite frank. And I just feel that we get to now put people in spaces doing what they love more, and really kind of passing along the things that we don't love, like admin tasks. Like, who really likes to be picking up calls or writing in charts? What was your favorite part and not so favorite part when you were in the front line?
When I was in the front lines of care, it was really connecting with those families and the patients. So treating them like they were my loved one. That was my favorite part. The not favorite part was the same as everyone else. Charting. We didn't even order supplies through a computer. We had think of
You had a call?
a supply room. No, we had a room, but they had barcode stickers on them that you had to take the sticker off and put it on the patient charge code card that was collected every day. It was much different, and then being in trouble because sometimes you're moving fast. Yes, I forgot to take the sticker off the toothbrush label that was in the patient's room. And someone saying, "You did not charge for the toothbrush." No, I forgot.
Listen, I know you don't want to age yourself, and I hate to ask these questions, right? But you're in this space of 20 plus years in this environment. There has to be something that brought you here. It wasn't just one day you woke up and said, "I want to help people," or was that the thing? Like, you live high school, did you automatically, this is your career path? Was it family that influenced it? How do you get into this space?
I actually left high school. I'm born and raised in Minnesota. I went to the University of Minnesota because that's what my parents were like. "You leave school,
Okay.
you go to college." I was like, "Okay." And I went to University of Minnesota for one semester, maybe two. and I hated it. I'm like, I don't know what I want to do. I hadn't picked a major. It had actually never crossed my mind. I took college prep classes through high school, but had no true desire. I didn't pick a major, so I was just kind of in general education. And I decided I'm going to disappoint my folks and I'm going to leave the U. And I had the opportunity randomly, shout out Shalom Home in Minnesota, a Jewish nursing home said, we will hire you and pay you to get your certified nursing assistant
Okay.
certification. So they paid me to get that trade. And then I just fell in love with the connection, being able to truly care for people and to serve people. So that's how I made it in.
Wow.
Someone
Purpose.
someone gave me
Purpose.
an opportunity.
That's just purpose. That's I'm a big believer that life brings you to these opportunities, right? As long as we don't give up, and that's just something that I have to remind myself: don't give up, even when times are hard. And for you, it was you didn't give up, right? You were still moving. You were trying to pivot. You were trying to figure out the next lane. You just knew you wanted to do better in your life, right? That opportunity presented itself. You realize, wait, there's a lot of passion, a lot of purpose here, and the
Absolutely.
money followed. And look where you're at today, October, right? And you've also made some sacrifices of your own because you did leave home, and now you're in Texas.
Yeah.
What was why did you make the move, and was it scary for you? Because a lot of people want to make this move, but comfortability is the thing, right?
Yeah. So I have lived in 8 states as an adult, but moving here to
Wow.
Texas, I moved from the New Orleans area, and I have been there almost 10 years. And my career again has been fortunate and has moved me a lot, but I've only lived the places that I've lived the longest has been home, where I was born and raised in Minnesota, and then New Orleans. And what was scary was leaving, like you said, the comfort. So I wasn't afraid to move. I've relocated to places where I don't have friends and family, but I was comfortable there. My kids were comfortable there. A lot of my moves, I haven't always been a single parent, but it wasn't a fear of coming here. The fear was more of the unknown. I'd also been with my last org 7 or 8 years, kind of knew they're crazy, their expectations. So the fear was I'm leaving something known, viable, to take a chance on an opportunity here. And I will say it is definitely paid off. I'm also a proud member of Zeta Phi Beta Sorority Incorporated. So I don't have the fear usually of moving to a new space because wherever I move to, there's a chapter and there's already a sisterhood. So I just encourage someone to
Yeah.
get involved in organizations that might be national, even if they're not sororities or fraternities, but you have then a natural network, if it's through service or whatever, that'll allow you to shift and have connections wherever your path is pointing you to.
This is very interesting. I didn't go to college. All right. I know about fraternities. I know about sororities. I probably would have probably been part of a fraternity if I would have went to college. And you just mentioned the chapters, and I see it all the time, right? I see all the ladies with the Zetas and all these different organizations out there. So you're telling me there's chapters everywhere I go. You join this family. What does that look like? So you go to Texas. How do you find this family of yours?
When you're active, most Divine Nine or historically black colleges and university sororities and fraternities are active. They're a lot different than other sororities and fraternities that are only college pledged. Like when you sign up here, it is for a lifetime, and it's most often about service. So it's giving back. That's one of the common
Mm.
themes through all nine is giving back and serving your community. So you'll find it, but there again are multiple areas that have chapters. My daughter just told me she is going to be a big sister. Well, I remember when I was 18, I was with the Big Brothers, Big Sisters organization and had two big sisters or two little sisters during my time in Minnesota, right? That'll be forever for her. I can reach out now and find that network of people. So really it's just, again, connecting back to people who have the same type of passions that you have.
I love that. You mentioned your daughter. You got two. I think that's how you had two kids.
I do.
Daughter's your oldest.
She is.
What do you tell your daughter from a woman of color that was taking a risk that you probably didn't see a lot of this as you were going through, your journey? What kind of advice you give your daughter as you're taking this leap of faith?
The advice that I give her most often, because she is an early careerist and going through it, is to trust herself, to make sure that she is open to opportunities. She is a perfectionist. She does not get that from me, but that to grow, you're going to fail.
Yeah.
It's okay to fall down. It's okay to be uncertain. I tell most people often, I know it's cliche, be afraid, but do it anyway.
Yeah.
How do you learn and grow? My largest growth in leadership, because I've only been in corporate America 20 years, have been the leaders that have let me fail. Like fall down, see me in the rabbit hole and say, you ready to come out of there? And let's talk through how you got down there and how you're going to get out versus protecting me from trying it.
If the Heart and Hustle podcast has ever sparked any idea or made you think differently, do us a favor. Make sure to guys share this, post it on LinkedIn, or even text that nonprofit friend that you just have. Whatever works, this is what keeps the conversation going and allows us to just grow this community together. Seriously, we appreciate you. Okay. Yeah, no, I love failing. As much as it's when you're in it, it sucks.
Yeah.
And when you're in it, it's like there's no way out. But that's when you got to have good support system. You kind of mentioned it, right? Having a good support system, being okay with failing, and really kind of taking a step back, as you mentioned, getting out of that rabbit hole and saying, what did I learn from that rabbit hole, though? Because there was something there to learn. Don't get me wrong. Through all failure, there's lessons there. But I love it. I love that your daughter is in this space of becoming a young adult. The world's not always going to agree with her. You are right? And she's it's not going to be perfect, and she still got to kind of move through it. And representation. How much does that matter for you, being a woman of color as well as stepping into new rooms?
Representation is extremely important to me. I used to say, so probably in the last 6-8 years, there's been like, here's the first Black X, Black woman of X, Black woman of Y, Black man of Z of all these hundreds of years. And if anyone ever checks my social media, they'll see where I'm like, celebration and crying, right? Because here we are, 2020, we're still saying the first X. Like, these folks have been qualified for ages, and I will, obviously, I'm a Black woman. I always pick on Black women. I'm like, we are the most educated, likely the most over qualified. And then when you look at, she is the first X, and you look at her predecessor, it's like, and no offense to those who have associate's degrees. I have one, right? But her predecessor had an associate's degree. She has 2 undergrads, she has 2 masters, a PhD, a law degree, and she's the first, so qualified, but was never given that opportunity.
And it's sad. I was talking to another leader, and she just kind of told me the only reason she went to go get a doctor's degree is that she can get even more of the ugly faces when she walks into a room. And she said, I didn't need it, Ephraim. I can't remember. She's like in her 50s. She said, I don't need it. I'm very successful. But if this is what I need to show up into these rooms, guess what? I'm going to show up into these rooms.
Yeah.
And I was just actually having a conversation with my neighbor, because I'm probably like 2 classes away from an associate's degree. But I've been able to build businesses. I've been able to run nonprofits. I've been able, to do a lot of things with even the background that I have of sexual abuse, adoption, all these different things. And I can't stand that sometimes this piece of paper is what allows someone else to get the upper hand on someone, when ideally, we put in the work, like myself, I've been working since I was 15 years old. So when it comes to people, I got people skills, right? I understand what that looks like. People come out of school, and no disrespect, as you mentioned, to even to those, but it's like I run circles around these people. You're really good at what it looks like black and white, but do you understand people?
Right.
And like you said, what you loved the most was the people part of it, because not everybody can do that. Not everybody can be at the bedside and have patience and have compassion, right? Be loving, caring. That's just something that we're taught as, from early childhood, to be respectful. Yes, ma'am. Yes, sir.
Right.
You know what I mean? So I love it. I love that you're in this space, that you're being a representation for your own kids, but even for other leaders. And as you're talking about being a leader, what are some of the values that you instill into your team and those that you come across that you're trying to build up to be the next generation?
What I'm trying to instill is authenticity. So I'm a people person. I sometimes chuckle, and I don't have any degrees on my walls. Some people do. Again, no offense to those that do.
Yeah.
And it's funny. And someone was like, "Well, why not?" I'm like, "Because ultimately, I'm from the hood, and I don't want anybody to
Yeah.
ever get it twisted. Like, I know where I came from, and I know who I am. So the piece of paper doesn't make me. It definitely opened the door. I worked for it. But what people often say, especially those who I lead, is like, oh, I want to do that like you. You don't. You want to do it like you. What I learned very early in my career was learn to lead in a style and a space that aligns with who I am authentically. So we've all had horrible bosses. There's some things you're like, I will never do that. Well, don't say you'll never do something. I've said that before and I've done it, but I've done it in a way that is with kindness and empathy because it needed to happen. So I tell people to find what works for you, how you can connect with your team. And then I give back through mentorship. So I shout out Zaya at Houston Tillotson. I am a mentor to a future physician. So I'm hoping to instill in her, how is she going to the same compassion and empathy I have with my team? How will that translate for her when she's in a room with her patients? And she's definitely going to be a physician leader. So what does that look like? How does she
Yeah.
balance that and be authentic?
You talked about mentorship. I'm a big believer that we got to have mentors in our life. Do you remember, recall those mentors that you probably still have in your life or have had? And what are some of the things you remember about those mentors that they've kind of poured into you?
I have one. I have several, so I still have them. But I have one that I can think about very early in my HR career. She gave me the chance to be at a Fortune 500 global organization and join her team, and she just trusted and stretched me. She said, "I want you to lead this training budget." I'm like, I've never led a budget of anything. She's like, "And you never will if you don't." I'm like, "Look, girl, I am check to check. I'm barely balanced. My checkbook is not
I
balanced.
love
If you
that.
want me to have hundreds of thousands of dollars to develop a plan." And she really just encouraged me. And then when it was time for me to leave, I had the opportunity to promote to a much larger organization and be a manager. I was super afraid. And she was like, "You got it." It was again moving. And she said, "I'm a phone call away." And she has forever and always been. That was back in 2007. We met in
Wow.
2006. And here we are 20 years later. She's still a phone call away. And she was an
Wow.
executive that looked like me and has just truly encouraged me and said my name in rooms where I was not at, that allowed me to continue to grow.
And that's the most beautiful thing. When I always say, when someone can see you for who you are, not for where you're at, right? She knew you had the talent in you, even sometimes when we don't even know that we have the talent in us. And that's huge. I actually just, reached out to my old high school teacher just to give her flowers. I graduated '08. You know what I mean? But when I sit here and think about as you mentioned, the rooms that I'm in and the spaces that I'm in, it comes because someone believed in me years ago and told me that I had the talent. And I believed it and I worked towards it, right? And it wasn't just her, there was so many different people, but I will never forget those people that poured into me when I was empty. Or I thought I was empty,
You were
right? Like I
full.
wasn't empty. So no, I really love it, and I love that you're in this space and that you got these young kids because it's not about us. Like she's seeing everything, and it's he and she, right? You got a boy and a girl.
Yes, they both are. Yeah,
They're
one of
both seeing
each.
everything. Yeah, that's the way to do it. I don't know how people have more kids. I got one boy, one girl. I'm done. I hear you.
Same.
Do you ever think to yourself, man, I should have had three? Because right now I'm not
Absolutely
thinking of it.
not. And my kids are 8 years apart. My daughter said I was the only child for 8 years.
Wow. Good relationship though with the brother and sister.
Oh my gosh, they're besties. Yeah.
Yeah. That's so good. My wife and her brother are 8 years apart, and not the best relationship, but life was also happening,
Right.
and they separate and all that other stuff. But no, it's cool that you're in this space for real because I have a daughter of color, right? Half Latin, half black, and we always just try to instill these things. You can do whatever you want. Like you want to play drums, you're gonna play drums. You want to sit here, like whatever.
Yeah.
But we also got to let her know because she thinks like ballet. Well, my brother can't do ballet because he a boy. Listen, nowadays they can do whatever
You
they
can
want.
do
You can do
whatever
whatever
you
you
want.
want. You want to be, the next president? Go be the next president.
And you can.
Yeah. Who are some women actually leaders that you've looked up to throughout your life?
Non-famous ones are the mentor I just told you about. She is
Hmm.
just we are so polar opposite in personality, in style, but to still see her executive presence and command a room in a way that she owns that is for her. I have a mentor from New Orleans. Her name is Laverne. I really look up to her style. She was a chief administrative officer for one of the parishes in the New Orleans area. Doesn't have a degree. Extremely intelligent, politically savvy, just watching them go. And then I would say, you get the question of like, if you could have dinner with one person, dead or alive, like who would
Yeah,
it
yeah.
be? And I'm sure lots of people say this, but I intentionally mean Michelle Obama. Like hearing her story, seeing becoming just the vulnerability she has, right? Like
Yeah.
to hear her say, like, I had imposter syndrome. I had to live a perfect life in the public eye for
Yeah.
8 years. Just the realness and how she inspired others to become who they are through not worrying about what others think is amazing to me.
Funny you said that. I was talking to Nausea from Rock Creek. I can't remember exactly where, but obviously a black woman, and she was in her office, and the back wall has Oprah Winfrey, Beyonce, and Michelle Obama, right? And she just started talking about the history, but I felt like we missing one person that we don't give a lot of credit, and that's Whoopi Goldberg. Like Whoopi has done some work. Come on now, why people missing out on Whoopi?
I just got her book, so I'll let you know after. I don't know enough. I
Good.
only know the cursory Whoopi.
Yeah, no, man, that's she's been in the game for a long time. But no, those are all good. And Michelle, exactly what you just mentioned, authentically herself at all times. You mentioned that's one of the values that you kind of live by as well as being authentically you. And how long has it did it take for you to know that? Because I say it wasn't until I was 30 years old where I realized my worth. And I realized that, you know what? My God given talent was my voice, something that I shied away from for so long because of being picked on, as a young kid. And just also just my life, right? I felt like I was always less than. So 30 years old, I'm 35, 36, about to be 36. When was that moment that you realized, wait, I am who I am. I'm authentically me. I'm going to show up authentically me.
Well, it's interesting because I had two shifts. So how you're raising your kids, be and do whatever you want, those were my parents. I did not get imposter syndrome from childhood. They were like, what do you want to do? You want to sing? I can't sing worth a
Same.
lick. Grammy Award winning, here she comes. You want to run track? Slow as heck. You got it. Olympic medalist. Like, my parents didn't play about me. I could do and be whatever I wanted. And then I lived life. I was great. And then I got into a corporate America space at about 30. And I had lots of doubts. And people said things that just made me like showing
Mhm.
up in rooms where I was the only one, that made me feel like, how's she getting in here? Oh, that's the affirmative action hire. Even if they didn't say it out loud, they made me feel that way. And I felt that way for about 5 years. And I did a lot of soul searching. My faith is important to me. And I just prayed.
Amen.
And God said, if I take you there, I will take you through. I prepared you and I prepared the way before you ever showed up. So when I tell you to go, you go and don't ask any questions because I got you.
Mm,
Um,
mm.
and that, so till that time, so about 35 is when I shifted back to
Okay.
I am absolutely where I'm supposed to be all the time. But I'm human, so I still have my
Yeah.
bouts of
100%. Yeah,
imposter
yeah.
syndrome and doubt, but it turns off much faster to
100%.
move forward.
I think it's to me is a lot to do with the mental, right? Like if your mind is not well, you don't rebound quicker, right? And that is so true. There's so many times where I started to doubt myself and I had to immediately shut that off and say, that's not true. Like keep doing. When life starts to hit hard and you're like, I can sit here and dwell on it or I can keep going. Keep going. You got this, right?
Yeah.
And I loved what you said, how God brought you there and he'll get you through. Because my wife said something so similar to me when I left my corporate job, and I was so in, 9 to 5, like I had a job. I would show up to this office 9 to 5, had no idea what the next chapter of my life would be. I just had to believe in myself. And because people were believing in me, people were asking me like, "Yo, how much do you charge for this?" Or people were telling me, "Oh, this," and I loved the job that I had. I was working for the airline industry, traveling the world, but I left that job with a stay-at-home wife, right? Stay-at-home mom. Sorry, let me not discredit her. Stay-at-home mom of 2 kids, a mortgage, and I was the only income. And I would remember working so hard, and at the end of that year, going to my wife, all right, and she says, and I ask her like, "Hey, we're tapped out on money. What do I do?" And she said exactly that, October. She said, "God didn't bring us this far for you to just quit now, did he?" Right? And it is that. When God speaks, you just got to listen.
You do.
You got to have faith. So I love that you tap into that. As we continue to kind of wrap this up, people are watching, right? People are asking for that, looking for that advice. And I want you to speak to another young woman of color because the representation matters to me. Not a lot of Latinos are in the space that I'm in, and not a lot of, women of color are in the space that you're in. And I know that because I've spoken to 200 plus leaders, okay? And it's very handful. What do you say to those that may be in this space of the unknown, of trying to pivot, but they feel, as you mentioned, imposter syndrome?
Yeah. My advice to you is, and I think you said it, believe in yourself as much as you would believe in someone else. So when those thoughts come in your head of like, oh, I can't do it, what would I do? Think about how you're gonna hype your bestie up. Like, girl, do
Go
this. You
bestie.
got this. Be your own bestie.
Yeah,
Hype yourself up, but also make
I
sure
love
you're reaching out, making connections. You don't have to just make connections with people that look like you. Branch
it.
out, do
Yep.
informational interviews. If you start new in an organization that doesn't have a formal mentorship program, ask around. Like, who's going to be open to taking me under their wing? Who can I learn from? And remain curious. I think sometimes
That's
we get
good.
to a place and we're like, this is my job, this is my career path. And then you're like, what are my next steps there? Understanding there are career ladders, there's sometimes career lattice. Maybe you're not meant to go up just yet. Maybe you're meant to shift horizontally to a different area or in a different space, and just being curious and open to do that. But remembering that all of those shoulders that we stand on for those who open doors and have given opportunities before we got here, we owe that to them, as well as to be the shoulders that the next generation is going to stand on.
Okay, October with the motivation on this Friday. Uh, I'm all about accountability, and I'm all about speaking things into existence. All right.
Yeah.
So last question.
Yeah.
So next time that we talk, I gotta have something to bring up. Like October, I remember when you said you were gonna do this. What is that thing that you would want to accomplish in the next 5 years that you've probably written down and no one knows?
In the next 5 years, I really want to be in a space that my worth and my voice is in spaces that it's not today. So being a keynote speaker.
Okay.
I am a 9 to 5er. I actually do not have the discipline to quit my job unless God tells me different. Then I'm gonna move. But I wanna do a TED Talk. I want someone to say, "Hey, we like what you're doing as a leader, as a human. Can you be the keynote at this event? Can you do X? Can you do Y?" So in 5 years, I'll have you in my audience for my TED Talk,
Let's go.
Ephraim.
So I found out October. Let me tell you, because I'm the same way. I want to do a TEDx as well. So I heard there's two different. There's a TED Talk
Yep.
and there's a TEDx Talk.
Correct.
TEDx being more chapter in your communities. Their one in Orlando just opened up or just came back.
Okay.
So I did sign up for it. Obviously, I didn't get it. But going back to what we just said, October, right? As I look at the list of people, it was people with PhDs. It was people in these spaces. They're no better than me and you, right? We just got to wait for the opportunity and create those opportunities.
Yes.
We got to do so good, damn near, that somebody is saying, hey, we're going to overlook that you don't have all, but it doesn't, I just don't understand. I got so mad when I seen this. You don't even know, October. I'm like, really? Everything I've done in the last 20 years, but you know what? God's time, right? We just got to wait for our time, October. But no, I'm definitely excited for that. I mean, there's so much on the horizon for you, and you're just kind of getting started, right?
Absolutely.
Like you just made this jump to where you're at today. Few years, 2-3 years? Am I mistaken?
Kinda. I've been in HR, went to
No, I
operations.
mean now in
Just 2 years here in Texas.
So you just made a jump, right? You got to get a little uncomfortable. Now you get comfortable again, then get uncomfortable again. So TEDx Talk definitely about the next time that we're conversating. Where can people find more about you personally?
Yeah.
Is it LinkedIn, Facebook, but also some of the organizations, URLs and socials?
Yes. LinkedIn. I'm the HTTPS www.linkedin.com/October. That tells you how long I've been on there. I actually just have my first name, so I'm an OG on that platform. My Instagram is open. It's at Rabatco1. So that's October spelled backwards and the number 1. If you want to follow me there for shenanigans, not all
Okay.
professional things. And then the organization I work for, you can find us at Central Health Texas .net. Within that, I sit on the senior leadership team for our FQHC clinic, which is community care, and that's Community Care Texas, communitycaretexas.org. So check us out. Contribute if you're in the Central Texas area. Please send folks who are uninsured or underinsured to a space where they can get quality and dignified health care.
I love it. Well, October has definitely been a pleasure. I can't wait till the next time we talk and you tell me that you are either getting prepared for that TEDx or you invited me to a TEDx. If you guys are still watching, make sure you guys do like, subscribe, and comment. This has been October. My name's Ephraim. We'll catch you guys on the next one.
All right.
Latest.
Thanks, Ephraim.